All right. Well, hello, everyone. I'm Nancy Brooker, your Living in Yes coach, supporting women in their journey through peri and post menopause. And today I'm so excited. We are talking about something that affects so many women and is something that we tend not to get help on because it's sort of an uncomfortable topic for some people. It affects about 84% of postmenopausal women, and 1 in 5 women from the ages of 40 to 45 will be affected by this. And a slew of women in between will be affected, and even some younger than that. So it's a really important topic, and that is the genital urinary symptoms of menopause, GUSM. And I'm so excited to have Nicole Watson here today from Aramasa Physiotherapy Associates to help us navigate a conversation on what exactly this is, how it shows up in our lives, and what we can do about it. So thank you, Nicole, for being here with us today. I'm just going to read, well, I'll just let you say hello.
Hi.
I'm just
Happy to be here.
Yeah, I'm just going to read your bio real quick so everybody knows who you are. So, Nicole is a graduate of the University of Western Ontario, University of Guelph, and McMaster University. She graduated over 26 years ago and has expanded her orthopedic knowledge and skill set by completing manual therapy levels 1 to 5, as well as many special interest courses. She's completed her pelvic health levels 1 to 3 and has been treating pelvic health patients for over 24 years. She's taken courses related to incontinence, perineal pain, pelvic organ prolapse, pregnancy, bowel dysfunction, low back, pelvic girdle pain, breast cancer rehabilitation, and menopause. She also treats males for chronic pelvic pain and erectile dysfunction and post prostatectomy urinary incontinence. How did I do with that?
You
Uh,
did it.
Her treatment includes the use of manual therapy, specialized therapy, and soft tissue release. And her clinical interests include back, hip, women's health, chronic pain, and pelvic health. And she has been the clinical leader for the pelvic health program for over 10 years and is responsible for mentoring other EPA pelvic health physiotherapists, supervising physiotherapy residents, and leading clinical rounds and keeping the staff up to date on pelvic focused resources. And most recently, in April of 2024, Nicole received the Canadian Physiotherapy Mentorship Award for her dedication to that role. So we are in for a treat today. And I just want to add one more thing. Having worked with Nicole myself, I will say that she is so passionate and so knowledgeable in her area of expertise and very warm and compassionate and provides a really safe and supportive, comfortable space for women to come and feel supported in this area, which can otherwise be very personal and very uncomfortable. So I appreciate you both on a personal and a professional level, Nicole,
Thank you.
thank you for being here. So after all that, tell us a little bit about
Oh
your
boy,
story, because you've been doing this for a lot of years.
I
You're
have, yes.
a rock star. You were doing it before it was, anybody ever even knew what it was. So,
Yeah, I did take my first pelvic health course in 1999, so graduated in 97. And it was actually just out of my own concerns because I was a young runner at that point and I was leaking as I stopped running. It was a very interesting case. And my family doctor was just couldn't figure it out. And he went to colleagues and asked, and he came back to me. He's like, we don't know. Like, so I went kind of searching for my own answers, I guess, in that sense. And I saw the course pop up. And at that point, there were two physios out of Quebec that were teaching it, and they still do a lot of teaching. And so I went and yeah, took the course, and I was pregnant at that time. So it was interesting because back then they wouldn't allow us to do an internal exam on a pregnant woman. That's completely changed now. Um, and so I learned something for sure, but I felt like I was missing out a little bit on, you know, what that how to how to teach people if I didn't have experience myself. So I went back and redid the course a year later, and that's when I really started in 2000 started taking on patients. And yeah, it's been a journey for sure. It's I worked, had a really unique experience in working with one of my mentors in Cambridge, actually, Carolyn Van Dyken, and she started Pelvic Health Solutions along with Nellie Fagani. So those two ladies now have really taken over a lot of the teaching in Ontario and even Canada. So yeah, so worked with Carolyn from 2009 to 2012 and like learned a ton. Like when you're working with the person who's doing the teaching, it's great. So that inspired me then to kind of, take on a little bit more of that role and join EPA, and here we are. So
Yeah.
it's yeah, and I did get my answers. So
Yeah, even better.
so
Eh?
I was able to help myself, and with all of that, I've just yeah, it's definitely a passion of mine to help women with these concerns because they can be very limiting, right? It's a very private issue, but it can be very isolating too. Like
Yeah.
yeah, if you're going out and you're looking for every bathroom, or if you're really dealing with a lot of pain or discomfort, like that can really impact your whole life. So
Yeah, it can
it's life
be.
changing.
Yeah, it can be.
Hmm.
I know that, in my experience with the women that I work with, there's a lot of self-judgment. There's a lot of fear of, like, there's fear of being judged by other people, fear of even coming to see somebody like you. And
Hmm.
what are they going to think? What did I do wrong? Like those sorts of things, which are,
Hmm.
once they meet you and actually get the support, obviously those fears dispel, but it's hard to
Right.
put themselves there, and they may even socially isolate, like you were saying, but they feel like
Hmm.
nobody else is going through it, or they just don't want to be out there in case something happens.
Yeah,
And like
exactly.
it affects so many, affects your relationships, and we're going to get
It
into
does.
all of this.
All
So
that. Yes,
we'll just keep going because we could both
for
just
sure.
keep talking. So
Yes.
tell us this long word when you were it's a mouthful, genitourinary symptoms of menopause. So tell us a little bit, like, what exactly does that mean? And what are some of the more common and even not so common symptoms that women might experience? And
Okay.
maybe not even realize that's what's going on.
Right. So we do know during menopause we have that really significant hormonal shift in our body, right? So particularly with the decline in estrogen and progesterone. So with that, it can lead to a lot of changes in our urogenital system, including alterations in the structure and function of the urethra. So, some of the common changes that occur around the urethra during menopause are known as that genitourinary symptoms of menopause. And I know it's a mouthful, but it has sort of replaced the term vaginal atrophy, which really wasn't a nice term, anyways. So, it GUSM for short, as you said. So, we do speak of it that way. So really, we get decreased urethral elasticity. So estrogen does help with that, and as estrogen declines, the tissues of the urethra become less elastic and more prone to thinning. Okay, so we have that as well as urethral dryness. So the lubrication around that area really gets decreased, and this dryness can contribute to discomfort, irritation, and an increased risk of UTIs.
Hmm.
So then we also get the muscles around there getting weak, right? So estrogen helps with our muscle strength as well. So it helps to maintain the tone around the urethra and all of that. So with that decline in estrogen, then we get that weakness, which really leads to that decreased ability to maintain that urethral strength and contraction there.
Hmm.
So a lot going on around the urethra, which then leads to some increased urethral symptoms. So we can get urinary urgency, frequency, and nocturia, which is that term for waking up in the middle of the night to go pee. So, once a night is pretty average. It's pretty normal for anyone over 50. However, if that's leading to like sometimes I see women 5 or 6 times a night they're up. So, with altered sleep patterns related to your bladder, then that's really going to impact your life,
On
right?
top of
So,
already waking up because of hot flashes, or yeah.
well, yeah, for sure. And you can have urinary frequency at night. Some people I see just have it at night and they don't have it through the day, or they can have it at day and it's,
Uh,
during the day. So we really, that can be very problematic. Um, so then with that we're also at higher risk of UTIs. So a lot of women in this age group, like when they're getting to that perimenopause, menopause time of life, they start to notice like I'm getting these UTIs all the time. So the reason is because of all the changes around the urethra. And there can also be changes in your urinary microbiome and that we get decreased defenses against pathogens there. So as a result, then we're more susceptible to those UTIs.
Hmm.
So that can obviously lead to painful urination, increased urine frequency, and urgency. So if you have those symptoms, it's always important to go to the doctor, get it checked out, and make sure it's, in fact, an infection, because sometimes we have those symptoms when in fact the urinary culture comes back negative.
Hmm.
So then we know, maybe we can interact with the pelvic floor, and that's when we see some really nice changes. And, oftentimes I hear from women, I've had these symptoms a long time. I've received numerous antibiotics. They thought it was an infection all the time. And like I was getting negative cultures back, but I'd already completed the round of antibiotics, right? So if we can get that urinary culture done and see what it is, like sometimes it has to be treated. And I've definitely, sent women on their way. And I'm like, no, we need to look at this and get this treated and then come back to me once it's treated, because we can't treat women if they have an active infection. So anyways, so with that, we just, if we can release the pelvic floor, if we can, change those tissues around the urethra and, get them to do their contractions, and that can bring more blood flow there. That can start to make some changes.
Yeah.
However, they may also need, more help, like with such things as vaginal moisturizers or vaginal estrogens, right? So that is more, I can educate on all that, but I can't advise women on any of that. I can just say, you know, these are your options. Go talk to your doctor, go talk to your pharmacist,
Yeah.
and just kind of figure that out.
Yeah.
So anyways, it's amazing to me how many women are not, like I have this discussion daily in my office, like how many people are just not aware of those things that they can do and use, right? So
100%. And what else I love that you're saying is that it's very integrated. I mean, it's not like you're discounting, there is a time and a place for medication, whatever you might need, but there are all of these things that you can do as well, that you can take control of your own
absolutely.
experience. And there are things that you can do. And you're right. Like I'm amazed as well at that women don't know, like that we're never taught. You don't learn these,
No,
right? So unless somebody shares
no.
it with you or, um, I, I remember, now this was when I was younger, but I can remember, um, I was having my period and I would say to
Yeah,
myself, oh my, I feel like my vagina is going to fall out. Like, not realizing that I was experiencing those symptoms and I didn't know to get the help at that time,
right.
right? Um,
Yeah,
Most recently with you, you helped me with low back pain as well, which I had seen many, many therapists in over the years to try and get help for. But I really did see a shift when we started working, with the exercises that you've been giving me. I've really seen a shift in even the back pain, which was quite unexpected and quite well. I mean, I had read about it, so I was hoping, but I wasn't very hopeful. Didn't want to get my hopes up too high, but so I think that's great. And yeah, just we need to get the education out there. We need to talk about it, and we need to help women get comfortable making the
exactly.
call and coming to see you. And I know that that's something that I work with my clients on. It's just getting comfortable and having those conversations and
Absolutely.
giving yourself the support you need. Even the conversations, with spouses, we'll
Absolutely. Yeah.
sexual health soon too, right?
For
So,
sure. Yeah,
um,
I always say to my patients, like I have these conversations every day. So for me, it's very comfortable and I'm so used to discussing it. But for somebody coming in the first time, it is like, I'm often the first person they've ever talked to
yeah,
about this, right? So yeah, so it sometimes, they can be quite shy, but as we start to talk, then I can see they're like, oh, okay, like, you start to open up a bit and feel more comfortable. And yeah, it sometimes it takes longer, but you know, oftentimes people leave feeling like they've been heard, which is great, right? So that's kind of, sometimes, the doctors are limited in their time they can spend. We're very fortunate. We get, a full hour with somebody to really go through all their symptoms. And a lot of times, even on our intake form, I get told, I've never been asked these questions before. So it can feel quite daunting when you're filling it out because it's a fairly long intake form, but often it gives people time to reflect on their answers in between, but filling that out and coming into the visit. So then they get to, they elaborate a little bit more when they get into the clinic too, which is great. So,
Yeah. Tell me
mhm.
about what are some of the risk factors? It's like, what are some of the things that might make you more prone to have these experiences than not?
Well, pregnancy and childbirth, that's up there for sure, right? So we do know obviously if you deliver a baby vaginally or even if you have a C-section, like there's changes in the pelvic region and in this muscle group. So that is a high risk as we get older, right? Age, going through perimenopause and menopause, that estrogen decline definitely and progesterone definitely impacts us. Obesity can be a factor, right? So some women, obviously that's a tougher one to change. So, I don't necessarily, I educate a little bit on it, but, that's something that it's going to take a little bit of time. It's not going to be a quick fix for sure.
Of course.
Chronic cough or chronic constipation, anything where we're kind of always have that downward pressure on our pelvic region, then that can impact this muscle group. So, yeah, so just, dealing with those sorts of things, getting the help you may need for that. Connective tissue disorders. So somebody who has like a lot of hypermobility in their joints or, their tissues are just a little bit more stretchy overall, then they could run into more like, with deliveries and things like that, then tissues can get stretched, but like they don't rebound quite the same, right? So yeah, so things like that. And then I'm going to add in like chronic muscle tension, like stress and anxiety. Like I see a lot of women who come to me that their pelvic floors are tense and tight, but so is like a lot of their body is, right? So they are in persistent pain maybe for other parts of their body, but this area of our body is interesting. It responds similarly to our neck muscles. There was a study done in Australia over 10 years ago now, and they put EMG electrodes all over the body, and then they put women in different stressful situations. And that really showed how these muscles respond. And it's very similar to the timing of our neck muscles. So we don't always feel it the same, though. We don't have as many receptors in this region. We don't recognize it the same as we do in other parts of our body. These muscles support, but they don't move a joint. So we don't sense them the same.
Yeah.
So yeah. So anyways,
Yeah,
it's
it's not something that you would connect like it's not something we just make a connection with every day, like stress and tension in that area, like oh my neck, oh my shoulders, whatever. That's pretty normal, but you don't
but
think
we
about
yeah, sometimes we do have bowel and bladder changes with that, though. You may notice you're going to the bathroom a bit more often,
yes,
right? Or your stools are a little more loose. Like,
yeah,
there are things that are happening in that region that you don't necessarily
yeah,
associate
you're just
with
not.
the muscles, though.
Yeah.
Yeah. Hmm.
So what I'm hearing too is that there are obviously things that are out of our control. Like, hopefully we're going
Hmm.
to age. Hopefully, if we're going to have
Yes.
children, hopefully they're vaginal births, those sorts of things. But there are things that we can control too. And
Yes.
that being things like exercise,
Absolutely.
and stress, we're getting ourselves a good self-care routine to
Yes.
manage our stress so that and we can control the support that we get from somebody like you or from a coach or from a um, I don't know, urologist, a doctor, whoever else you're going to go see on this topic, right? There are people out there. You don't have to do this alone. And so you do have control over that. So
You
always
do.
remember that. Yeah. So let's talk a little bit about, I don't think we've talked about sexual health yet. Some of the other
No.
issues that, yeah, what else do you want to tell us about the symptoms that come up and how they affect our lives, our daily lives?
Yeah. So, that was actually my last point of genital urinary symptoms, was there's an impact on sexual function, right? So with those urethral changes, we can get into some discomfort, even some irritation, even pain, right? So when you start to experience that, then, there's a loss of libido, there's a loss of, even sensation. Like you can really start to feel diminished sensations around the clitoris and things like that. So that can affect orgasm. Like there's lots of changes that can happen.
Mhm.
And, low libido is very common of what I hear. Obviously, I'm seeing women for problems in the region. So I have to really remember, I've got like, my group of people are having problems. So to
Yeah.
me, I feel like everybody's having problems because that's what I hear all day, but I
See it
know
all
it's not
day. Yeah.
everybody's having problems.
Yeah.
But yeah, so, it can really be impacted. And if we can change the musculature, if we can, get things relax a little bit and then get things a little stronger, improve that blood flow and everything, then that can really make a difference.
Yeah.
So,
I think it's
yeah.
really important for women to know that there's hope, that, there are,
Mhm.
they can see somebody like you and get help with these issues. And
Yeah, but again, sorry, coming back to like the local estrogens and the moisturizers, like,
there's that.
hyaluronic acid is a main ingredient in some of those moisturizers, and getting the right one for you and using a lubricant and things like that. So making
Mhm.
things more comfortable.
Mm.
The lubricant just is helpful in the moment, but the moisturizer gets absorbed. So that can, you know, yeah. So be like, if lubricant's like wiping something on your face and then shortly after wiping it back up, like it doesn't stay, right?
Yeah. And do you have a list of,
I do. I have a handout that I give
yeah,
women.
maybe we
Like,
can
yeah.
share that. Can we share that with the viewers or?
I probably can. Yeah, I do have it on my laptop, so I can pull that up and show. Do you want me to do it right at the moment?
Oh, no,
Sorry.
no, 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 no. I just,
Okay.
oh, we'll share a link to it or something. Yeah.
Okay. Yeah.
Yeah.
Okay.
Okay. Yeah.
Okay.
Perfect. Just because it's always nice to know what their options are, and then they can go talk to, their doctor or whoever, in getting help to decide which one to do.
Exactly.
Like, okay. So what you've kind of already talked about this a little bit, what happens in a physiotherapy session and and also what to look for in a physiotherapist. Just
Yeah.
a little bit more on that, I guess. Yeah.
Yeah, so your first appointment, I've kind of already alluded to, like you'll get, we'll send you the intake form ahead of time so that you become familiar sort of with the questions that it's going to be asked in the appointment. And once you're in the appointment, then we review that form together, and we can you can elaborate on certain questions or certain answers, and because it is kind of like a checklist that we go through, so we get your story a little bit more during that first visit. I always review my consent process with every woman. Like we send again that form ahead of time just to make you aware there could potentially be an internal assessment done. There does not have to be, though, so it's really up to the comfort of the patient. So, based on that, we will do an external assessment. So, take you through a lumbo-pelvic scan, like see how you move and how your hips move, how your back moves, things like that, and a kind of a little mini core tests. How do you transfer load through your pelvis, and how does your deeper core how do you connect with that? And then we could do an internal assessment, or we can just sometimes I'll just, palpate externally on a woman.
Mhm.
And if she's not comfortable with the internal portion, and underwear can be left on for that too. So it's just kind of get a sense of, can you connect with these muscles? I just want to make sure there's no bearing down when you're trying to contract.
Right.
That's called a paradoxical contraction, and it can happen. I've
Yeah.
seen it many times. Women think they're doing a great job connecting and contracting, but they're actually holding their breath and pushing.
Yeah.
So yeah, but it's a sensation down there, so they think they're doing it correctly. So, that's how a lot of education, right? We review the anatomy together. I show you what the exam looks like on my model, so you're very familiar with what to expect with all that.
Yeah, and I think that makes such a difference for women knowing ahead of time before they come in. Here's what it could look like. And at the end of the day, it's to your comfort level. So,
Absolutely.
nothing will be done to you. Nothing's forced on you. It's whatever you're
That,
comfortable with. We will
absolutely.
get the information that we can to help you through this journey. But it's to your comfort level. That's so important because right
It
there,
is. And you
stress
you
level.
want, yeah. Sometimes you need to get to know the person that's treating you, right? And that day
Yeah,
one is can feel very, it's a vulnerable area of the body. So we're very, obviously, and there can be some past traumas and things like that. So we're really making sure that women, have time to kind of process all that and when we get hands on the external part of the body and get things feeling more comfortable, then sometimes they're just more comfortable with the internal portion.
yeah, fantastic.
Hmm.
Okay, let's get
Hmm.
into some practicalities. So, um, what might be like the number one thing that women do incorrectly when they exercise that we can maybe help with a little correction?
Yeah, I would have to say breath holding, right? So, because that does cause a downward pressure on the pelvic floor.
Yeah.
So, a lot of people or women, I see men too, so I say people, but when I see when I see them in the office, it's just, can you contract your pelvic floor? And there's typically a breath hold associated with that. And then it's not till I usually, have them go through it a few times just to make sure that's exactly what they're doing. And then we discuss like the diaphragm, right? It sits underneath the rib cage and the pelvic floor is beneath. So the two should really move in the same direction. It's like a piston. So when you breathe in, your diaphragm will widen and lower, your pelvic floor will follow. So I like the idea that the diaphragm is really the driver and the pelvic floor is a passenger. And wherever this goes, this has to go, right? So
Yeah.
yeah, so if we can get that coordinated, so if we, whereas otherwise they're holding their breath and trying to contract against some resistance that's already pushing down, it's harder, right? So, but sometimes it takes a few sessions even to get that coordination.
Yeah.
So we can work on just trying to isolate the pelvic floor just by doing like little smaller contractions. And then once they get comfortable with that, then we can try to bring the breath into it. But
Mhm.
yeah, it's really important to
Yeah.
make sure you're exhaling on effort,
Yeah.
right? So if you're doing a squat, you go down into the squat, you inhale as you exhale and you come up, right? So, and then you can think of like, even engaging your bum muscles, your bigger glutes. If you squeeze your glutes, you're going to get some pelvic floor activation.
Right.
So
Yeah.
yeah, so it's,
Yeah.
if you can just start by doing simple things like that.
Yeah. Really making, and I think that's something else that we don't think about is making that connection between our breath and,
Yeah,
the exertion of whether we're, yeah, like what we're doing. Uh,
exactly.
okay. You're going to teach us like one little tip, one little trick that we can do. And like I said, you can use me as your demo. I'll just
Yeah.
direct me and
So
I'll do what you say. You won't be able to, our viewers obviously won't be able to see that I'm doing it, but
no,
um,
no. And that's the beauty of doing these exercises. Nobody can see
nobody
that you're
knows.
doing them,
I
right?
know.
You can be doing them just sitting, anywhere and nobody knows. So yeah. So I think just kind of taking you through sort of how to breathe, because a lot of us really do a lot of chest breathing, right? We kind of live here.
Mhm.
So if you can think about, and even when we think of doing a diaphragmatic breath, a lot of us push our bellies out, right? So what I want you to think of is like that an umbrella underneath your rib cage. And when you go to breathe in, you need to expand sort of out to the sides and even into your back a little bit. So I usually start this lying down
Okay.
so that you can really feel the surface beneath you and just sort of breathe into that surface beneath you and feel the ribs. Like put your hands on your ribs as you're doing that and just really kind of start to open up that lower rib cage. Okay, so we'll just take a moment and just inhale nice and slowly as you open up the lower rib cage and then exhale slowly.
I like to close my eyes when I breathe.
Yeah, absolutely. Most people do.
Don't do it when you're driving if you're going to do this.
No, 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 no.
Close your eyes. Don't do it when you're driving.
And so you're going to inhale slowly. And I always advise like a lot of people overbreathe, right? So they'll really like take their lungs or their rib cage to the max. You can start to feel almost like rigidity there. Like you can feel like, I can't go any further. I can't go any further. So you want to really breathe like 75 to 80% of what you think your capacity is. And that's going to keep it. The three keys to breathing is soft, smooth, and slow.
Mhm.
Okay. So if you can keep that in mind as you're doing that breath, you're going to find like we really advise about 5 minutes of this just to kind of relax. And that just calms your whole system. It actually starts to talk to the parasympathetic side of your nervous system, which is your rest and digest. And we often are in more of that fight or flight, right? Which is sympathetic. So it does a couple of different things. Yes, it expands your ribs, it lowers your pelvic floor, but it can also start to calm some of that stress and anxiety.
Mhm. And it feels really nice.
It does. It does actually. And if you're lying down and you're relaxed, it's actually very, very, excuse me, very, very nice.
Yeah.
And then the second thing, I'm gonna throw two things in here.
Okay.
So just with awareness,
I'm
like
actually
if
doing.
you were to if you were to contract, like you're trying to stop pee,
Mhm.
where do you feel that contraction? Is it more near the front of your pelvis, like near your pubic bone? Or do you feel like you're squeezing your anal sphincter? Because a lot of people squeeze, like they have a stronger anal sphincter region. So
Yeah.
when we're asked them to stop urine, they're actually doing the wrong area.
Yeah.
So we kind of have to focus a little bit more near the front.
Yeah. I'm feeling it at the front.
Yeah, you've done some practice though, right? So for people that haven't done this, that's going to be challenging. Although sitting up can also make a difference. So if you're sitting on your perineum and your pelvic floor, then you can connect with that a little better sometimes.
Mhm.
Okay. We usually start in office laying down just because it's easier to assess that way. But yeah, we'll get you kind of sitting and on your feet doing it as well. So
Okay, so I am, as I'm breathing in, I'm relaxing. And as
you're
I
relaxing. And as you exhale, you want to try to squeeze and lift.
make sure
Yeah. Yeah.
yeah, yeah.
And you can try like midstream on the toilet to see if you can stop the flow. You should not do your Kegels there, or like these are known as Kegels, if anybody's not familiar with that term. So there's a doctor in the 1940s that discovered women could voluntarily contract their pelvic floor, and his name was Dr. Kegel. So now we have Kegels.
Oh, I didn't know
So
that.
yeah, it's
Really?
any voluntary contraction of your pelvic floor.
Okay.
Okay.
Mhm.
So it is Kegels that we're doing, but we're doing it a bit more specifically, a little bit more isolated, and we do progress you through sort of an individualized program because sometimes I see women and they're very good at doing that, and other times we have to really coax other muscles around to kind of start to activate, and then we can eventually get to that contraction.
Mm.
So yeah, it's that's why it's important for individual assessment. I can't give
Yeah,
the
of
recipe for pelvic floor
course.
rehab because there isn't one,
Like anything.
right? It's
Yeah, just like
yeah,
anything.
yeah,
But if when you're, if you are at the point where you're almost there, you're almost ready to go, but not quite. One little thing that you then can do is just to do this breathing exercises for 5 minutes a day. Not only
yeah,
going to help reduce your stress, which then may help you get yourself to the point where you can pick up that phone and make that call, but it'll
yes.
benefit, yeah,
And I should mention actually, so symptoms that go along with tension in the pelvic floor are urinary frequency, urgency, and pain,
yeah.
right? So those are the main ones. So if you're experiencing that, you want to focus on the breathing and relaxation.
Hmm.
If you start to do the pelvic floor contractions and your symptoms worsen, you shouldn't do them, right? Now, Kegels aren't for everybody,
Hmm.
not right away, anyways. So we need to maybe sometimes work on that lengthening and relaxation first, and then we can eventually get to
Right,
activating the pelvic floor more. So
right.
again, it's individualized.
Yeah, that's
Mhm.
great. Is there anything that you wanted to add before we wrap up?
Um, no, I don't think so. I think we've covered everything that
So we've had a great,
I think
we've
we've.
talked about the symptoms, we've talked about the risk
Mm.
factors, we've talked about, um,
Oh, I know you asked me about what to look for in a physio. So you want to make sure, obviously, they've done their pelvic health courses. There is a way to do that is with Pelvic Health Solutions. It's pelvichealthsolutions.ca. It's a great resource for a lot of education on there. So people can go check that out and just see. And on there is Find a Physio. So you can enter,
yeah,
your location, and it can come up with a few different names. And then you can actually look at some of the courses they've taken, right?
yeah,
So everybody has to do level one for sure, and that really covers stress incontinence and prolapse. And then the level two gets into pain problems. And then level three is more like that chronic persistent pain. So, at least having had those courses under the belt, and then, you know, you can go from there. But,
yeah,
there's a lot of different courses, a lot of special
yeah,
interest courses that we can take. And they're all great. They all have their place. Yeah, it's
yeah.
just
I'll make
when I
sure.
first
Oh, go ahead.
when I first took my course, I got a one page with 5 abstracts on it, and that was the research in pelvic health in 1999. And now, like, I would have to quit my job to keep up with the
Yeah,
research,
yeah.
right? Like, it's
Fantastic.
exploded.
Yeah, yeah.
Yeah. So since 2011, we've actually been able to do the internal assessments within the scope of physiotherapy. So prior to that, we had to get the doctor to delegate to us to do an internal assessment.
Oh,
So unfortunately, women would call and they'd want to come in, and I said, okay, well, we have to get this paperwork filled out by your doctor, but the doctor wouldn't fill it out. So our hands were tied.
interesting.
So
Yeah, things have,
yeah,
thankfully, times have changed and,
yes.
uh,
So now you do not need that medical delegation or, to be done. So that's great. So you can access the care that you need.
and I'll make sure that I list that pelvic
Public health solutions. Yeah.
solutions.ca. I'll make sure I list it
Yeah.
on, it's down for everyone.
Yeah.
Okay, so The bottom line is, look, you are not alone. There are solutions out there for you. There are physical and mental, emotional aspects of these genital urinary symptoms of menopause, as in anything in life. But there are solutions out there, and you can be in control of supporting yourself by seeing someone like Nicole. If you are in this Southern Ontario region, you guys have like how many clinics do you have? Because you're not just in
Okay. Yeah, we have 9 clinics, but not all of them have pelvic health, but most do. So currently we have Alora, Orangeville, um, Acton and Georgetown, Burlington. Actually, our Burlington clinic right now does not have a pelvic physio, but we're hoping to get one there soon. And yeah, our Guelph Women's Health Clinic in Guelph, and also our Bullfrog Clinic, which is Bullfrog's the name of the plaza. So
Yeah.
it's yeah, it's within
Yeah,
Guelph as well.
yeah,
So
yeah.
mhm.
So definitely there's opportunity in there, and if you and some great tips for you if you're not in this area of how to find somebody who can help you. And of course, emotionally, if you're needing support to have those difficult conversations to um, deal with all the baggage that has come with you to this point in your life to help you get to the next point to where you want to be, then seeing a coach or someone like me can also help as well.
Mhm.
Good timing because somebody's just home now. So we are done. And thank you so much, Nicole. I really
You're
appreciate
very
your
welcome.
time.
Okay,
Fantastic conversation. I'm so excited to share this um, with the viewers and to get this information out there. I think it's really important. Yeah.
great. I'm
So,
happy. I'm happy to be able to share.
all right, I'm going to stop the recording as soon as I find the record button. Which somehow disappears on me.